I want to thank you all for coming out to this town hall meeting regarding your own Lonoke County's health. I want to begin by highlighting that the fact that you and I are here together today is a testament to our commitment to the health of Arkansan families. My name is Earl Morris, and I've been with the Arkansas Department of Health for 10 years. Before that, I practiced as a pharmacist for 5 years, where I cared for patients with a wide array of diseases, including diabetes, breast cancer, and thyroid disorders. I believe this allows me a unique perspective when addressing the risks and impact of endocrine disrupting chemicals on individual and human health. I understand many of you have concerns about possible adverse health effects related to exposure to endocrine disruptors. I hope to shed some light on the subject today and answer any questions you may have. So here is a brief overview of the content of today's presentation. I will begin by outlining some sources of endocrine disruption and then go into the effects on both human health and our wildlife's health. I will then identify some at-risk populations and some mitigation techniques that you may be able to use in your everyday life. And then I will end with future implications and conclusions. To understand what endocrine disruptors do and their health effects, it is important to understand the normal functioning of the endocrine system. Essentially, the endocrine system is a network of tissues that communicate with each other using molecules called hormones. Endocrine literally means secrete within. Some hormones you may be familiar with are melatonin, thyroid hormones, insulin, testosterone, and estrogen. But those are just a few of the over 50 hormones and hormone-related molecules called cytokines. Many of the functions of this system are organ-specific, like fluid secretion in the kidney, milk production in the breast, bone formation, and insulin release from the pancreas. The endocrine system also regulates many vital body functions, including heart rate, skin maintenance, growth, temperature regulation, blood sugar regulation, fertility, and digestion. Because of the critical role in so many different functions of the body, a disruption in any part can lead to serious disease. I will now describe the history of endocrine disruptors using two of the most well-known examples, DDT and DES. In 1938, the first synthetic estrogen, diethylstilbestrol, was created to prevent miscarriage and was marketed as safe. In 1962, Rachel Carson published Silent Spring and focused on the use of DDT and its threat on wildlife and humans and potential carcinogenic effects. Then in 1971, DES was identified as a cancer-causing drug and was shown to cause malformations in the babies of the mothers that were taking it to prevent miscarriage. In 1972, DDT was banned due to evidence of its endocrine disrupting effects, but effects and exposures continued due to its widespread use in the environment. In 1991, the term endocrine disruptor was first used and is still used today to describe these chemicals. In 1996, EDSTAC was formed to examine chemicals for non-estrogen endocrine effects. In 2002, the World Health Organization released a statement to look at the impacts of endocrine disrupting chemicals on broad endocrine functions, including reproduction, cancer, immune system, and brain function. Since 2002, more research has been done regarding these chemicals and their effects on human health, and I will outline some examples next. Endocrine disruptors as a group are very different from one another in their chemical makeup and have a variety of normal functions in society. Because of the diversity of these products, it is often difficult to prevent and study the effects of these chemicals. On a previous slide, I showed a brief example of how the endocrine system normally works. Endocrine disruptors often mimic or block a natural hormone or group of hormones in the system. Examples of these chemicals include industrial solvents such as polychlorinated biphenyls and polybrominated biphenyls, plastics such as BPA, plasticizers including phthalates, pesticides including DDT, antibacterials including triclosan, and even some chemicals in clothing called perfluorochemicals. Endocrine disruptors can seep into industrial waste, and pesticides can contaminate the soil and groundwater, leading to oral consumption. Additionally, plastics can leach chemicals and residues of pesticides are present on many foods and beverages. Polybrominated flame retardants and pesticides can be transferred to the skin or inhaled. Phthalates, triclosan, and parabens are even present in some cosmetics, antibacterials, and sunscreens and can be applied directly to the skin. Additionally, many endocrine disruptors can cross the placenta and are detected in breast milk. Because of the vast range of processes that the endocrine system regulates, disruptors of this system can have a wide array of effects on our health. Most notably and most studied, endocrine disruptors can negatively affect the male and female reproductive systems. In men, this can lead to abnormal testicular development, abnormal prostate development, delayed puberty, infertility, and even prostate cancer. In women, it can lead to abnormal ovarian development, delayed puberty, abnormal menstrual function, early menopause, and breast cancer. Because of the endocrine system's broad regulation of metabolism, disruption can also lead to infections, asthma, heart disease, and stroke. It has even been observed that endocrine disruptors may play a role in the development of Alzheimer's, Parkinson's, and ADHD. Children are by far the most vulnerable population for endocrine disruption. Within the past decade, there has been a shift from studying the effects of these chemicals on adults to studying the link between developmental exposures to later in life. Both the timing and the amount of hormonal exposure is crucial to normal development, especially in utero and into childhood. And these exposures have both immediate and latent effects, including physical abnormalities, especially in the reproductive organs, and functional defects. The same amount of exposure can have different effects depending on the timing of the exposure and development in both animals and humans. Children are additionally at greater risk just based on their lifestyles. Exposure to breast milk, propensity to touch and put objects in their mouth, their closeness to the ground, and the large amount of skin area relative to body weight. Additionally, pregnant women and men and women in reproductive years are at risk because of the exposure they can confer to fetuses. It is important to remember that outcomes may be subtle, unreported, or years delayed. Data from the Worldwide Fund for Nature have shown a troubling trend in the population of many species. In 40 years, the population of vertebrates in the world has decreased to nearly half the size. That, paired with an exponential number of chemicals in which these animals are exposed, and the lack of environmental monitoring at such a large scale, may indicate that these chemicals are contributing to population-level declines in our wildlife. An endocrine background for current wildlife population declines is likely but not proven. The amount of chemicals produced yearly is increasing rapidly, and individual chemical tests cannot keep up. The way we test chemicals one by one is simply not sustainable for the rate that chemicals are being produced. Because of the variety and low doses of endocrine disruptors, it's very difficult to assess safe levels of disruptors and therefore design research. It is usual to assess levels that are not associated with observable effects, but because of the variety and latency of these chemicals and their effects on humans, it is difficult to assess thresholds, and these chemicals likely have effects at very low doses. Also, many of the tests are done in adult animals, and it is difficult to assess the link between developmental exposures and outcomes later in life. These animals are just followed for a short period, so development of disease later may not be seen in studies. So what can the citizens of Lone Oak do? First of all, avoid smoke. Second, avoid heating food in plastic containers or storing fatty foods in plastic containers or plastic wrap. Buy organic food whenever possible, and avoid fatty foods such as cheese and meat whenever possible. Rinse your fruits and vegetables thoroughly with water, scrub them with a brush, and peel when appropriate. Cooking and baking will reduce residues of some pesticides even further. Individuals should wash their hands after applying any pesticides and before handling food. Additionally, store pesticides out of reach of children, and avoid giving your children plastic toys to play with, as some of the chemicals in the plastic may leach into your children's mouth. And last but not least, and most importantly, educate yourself. So just to go back over some conclusions and future directions, we really need more efficient ways to understand endocrine disruptors and their effects. The one chemical, one disease at a time method is simply unsustainable, and the potential effects of mixtures of these chemicals makes research even more necessary. When it comes to human health, the developmental years are really the most vulnerable exposure time for humans. This is due to the immediate and long-lasting effects of endocrine disruptors on humans later in life. These chemicals have both global effects on humans and animals, as can be seen by their effects on reproductive function and the declining population of animals worldwide. We need to continue to develop more approaches to both analyze the trace amounts of these chemicals in the environment and in the food we eat. As we better assess approaches and develop a better understanding of mechanisms, it will become clearer how to mitigate these exposures. The byproducts of manufacturing and combustion processes also need to be better analyzed and understood to help mitigate exposures. It is absolutely necessary to know where our risks are coming from to be able to reduce our risks. Because of the complexity of these chemicals and their exposure, we need better ways to evaluate the evidence that is already out there. And again, educating yourself on the known risk is very important. I have attached my contact information if any of you would like to speak further about endocrine disruptors. I want to thank you again for coming out today to listen to this talk and for your interest in your own community's health. It is just as important for communities to do their role in preserving their health as it is for public health officials like me to do my job. My previous clinical experience helps me understand not only the clinical side of these exposures, but also the individualization of every exposure and its effect on communities in Arkansas and within Lonoke County. Please continue being advocates for your own health, and with that, I will open it up for questions. Thank you.